Doctors Corners. We're here with Dr. Roumain from Tripod Fertility, and we're actually chatting today about physical activity and what is safe or not safe in particularly after an embryo transfer with a surrogate or even just an intended mother. But I know one of the questions that comes up a lot, especially when doing contracts, legal arrangements with a surrogate intended parents, is what is normal for safe activity after an embryo transfer. So maybe you could chat a little about what you would advise patients.
Sure. Okay. Yeah, no, that's a good question. It comes up quite a bit. So whether we're talking about a surrogacy patient or the intended mother, usually what we recommend is on the day of embryo transfer, we typically will tell patients to take it easy. It doesn't mean strict bed rest. You can do your activities of daily living, meaning, washing, standing, moving around the house. We just advise against any strenuous activity. And it typically will say 24 to 48 hours, the day of the transfer and the next day. After that, we tell patients that they can resume normal activity. Again, anything that can potentially be a dangerous kind of activity where you can fall or you can have trauma to your abdomen, we typically try to advise against that. And that is both during the implantation period to during the pregnancy. So what I tell patients is the activities that they were used to doing, cardiovascular activities that they were doing prior to pregnancy or prior to the embryo transfer are safe to continue, except those that where you can incur risk of fall, so or being hit. So, the kickboxing class I would avoid, but the same level of cardio activity from a different, let's say, aerobics class would be fine. We just advise not to start a new gym program just because you're at baseline, you're not at that level, but anything that you were doing before is safe to continue. When we talk about more of weights, same thing again, for safety, again, being in an environment where things can fall on you, things like that, just to be careful. In terms of lifting heavy items, I compare it to, let's say, if you already had a previous child and now you're pregnant with your second or your third, as you have a little one. So typically we say if you can lift a small child, that would be kind of the weight that you would be okay to lift. In terms of abdominal work, crunches, things like that, typically in the post-transfer period, we don't recommend doing direct abdominal exercises, but past that, once pregnancy is established and there are no complications, meaning there's no first trimester bleeding, we know that the pregnancy is well implanted and viable, you can resume those activities. What typically happens is that you end up having to stop them as the abdomen grows because it's just harder to do those exercises. So I would say typically it just happens naturally that you progressively stop being able to do them. And that goes for other physical activity as well.
Right.
You may move on to swimming because that's easier to do than what you were doing earlier on in the pregnancy when you were smaller.
So there's no particular cause for concern around cardio, but there might be something. I've just heard that there's an increase in body temperature.
Mm-hmm.
So hot yoga probably is not ideal.
Exactly. So you're absolutely right about that. So we don't want the body temperature to go too high. And that's the same kind of logic when if a patient has a fever, same thing, you want to have Tylenol to lower the fever. You don't want the body temperature to go up. So same with exercise. So you want to be in a well-aired place, and we want to avoid things like saunas, hot yoga, anything like that. But the physical activity itself and actually the cardio portion is actually a good thing because you want to keep your cardio health at a good level throughout your pregnancy and for delivery, because that is a marathon. You want to be in good shape to deliver. If let's say if you're delivering so what a good guideline for patients that it's easy to remember is that while you're doing whatever exercise it is that you choose that's cardiovascular, if you can talk while you're doing it, then you're okay. So if there's enough air going to your lungs that you, and that you're able to speak, there's enough blood going to your uterus as well.
Right. Okay, that's great to know. Thanks for joining today, and we'll chat soon.
My pleasure.